Hi everyone, welcome to the discussion of the forensic questions of this year's uh, FMGE, right? So let's begin and let's take up our first question. At autopsy, blood is present on the cranial surface. So the wording that I got was cranial surface. Actually, it should have been on the surface of brain. It is not removed by running water. What is the bleed? Okay. See, the answer to this question is option C, subarachnoid hemorrhage. Subarachnoid hemorrhage is a hemorrhage which is protected under the subarachnoid matter. So, if we are going to pour water on the surface, it will not get washed away. It will still be seen. Whereas subdural hemorrhage gets washed away. Okay. A lot of students said the question regarding meningeal bleed was probably another question also, or maybe this question was asked in a different way. Probably one way it was asked was that if there is an extradural hemorrhage, what uh, what rupture of vessels cause it. See, extradural hemorrhages generate, if that was the way the question was asked, extradural hemorrhage generates due to rupture of bridging veins which are bridging between the dura mater and the endocranial surface of the uh, skull. When they rupture, there is collection of blood on top of the dura mater, which is the extradural hemorrhage. So, if that question was asked, we are answering that question here also. If it was asked which bleed doesn't get washed away, the answer is subarachnoid hemorrhage. Okay, let's see the next question. What sign is seen in the image? A very prototype question has been asked in FMGE examinations multiple times. The sign which has been shown, which is depicted here, as you can see, there is discoloration in the white portion of the eye. This discoloration seen in the postmortem time period is due to drying of the eye. Okay, due to drying of the eye, right? And it is called as technoir. It is called as technoir scleroticus. Due to drying of the eye, the white portion of the eye develops these triangular shaped opacities called as technoirs. Okay. Kevorkian sign, which is also given as option number B, is also seen in the eye. But remember, Kevorkian sign cannot be seen by naked eye. It is an ophthalmoscopic sign which you see using ophthalmoscope, and you need to see this sign in the fundus. The retinal vessels which are uh, associated, the retinal vessels which are dilated due to the accumulation of blood after death, seen on ophthalmoscopic examination, that is Kevorkian sign. Let's see the next question. Oral contraceptive has failed and MTP has to be conducted. What is the time period till which it can be done? As per the provision of the latest provision of the amended MTP Act 2021, if there is an oral contraceptive failure, MTP can be done up to 20 weeks of gestation. MTP can be done up to 20 weeks of gestation in cases of oral contraceptive failure. It can be done up to 24 weeks, that is only in special cases. Special cases can be rape victims, uh, victims of incest or mentally insane females, or also in cases of victims of sexual assault during any uh, communal violence or civil unrest, right? So these are special cases. Okay. Then beyond 24 weeks also MTPs can be done, but that can be done only if there is a high chance of fetus gaining birth with severe congenital malformations. The allowance for that is only given by a medical board. Okay, so beyond 24 weeks, if fetus is expected to be gaining birth with severe congenital defects, medical board can allow it. Okay, so these are the latest provisions. Next question is, a person has a custodial death, inquest will be conducted by, again a very straightforward question. In these situations, inquest in these situations inquest is conducted by judicial magistrate. So judicial magistrate conducts inquest in cases of custodial death, right? uh, Executive magistrate will conduct inquest in cases of dowry death and exhumations. Medical examiner inquest doesn't happen in India. It happens in United States of America. And coroner's inquest also not happen in India anymore. It used to happen in India in Calcutta and Bombay, and it ended in Bombay in 1999. So coroner inquest doesn't happen in India anymore. Only two inquests happen in India: police inquest and magistrate inquest. Police conducts inquest in every situation of death. Magistrates in cases of custodial death, dowry death, and exhumations. In custodial death, it is judicial magistrate, and in dowry death and exhumation, it is executive magistrate. Okay, let's take up next question. A family died in a closed room which was full of smoke from wood fire. So a lot of fire was there along with lot of smoke, and the room is closed. So whenever there is a lot of fire uh, and the room is closed, what generates? What generates is carbon monoxide because of incomplete combustion of oxygen, right? So these people definitely would have died of carbon monoxide poisoning. The question is, which of the following finding will be seen on the dead body? So what do we see in cases of carbon monoxide poisoning? What is seen in the dead body? The answer is, we see cherry red post-mortem staining. So what are we going to see? Cherry red post-mortem staining. A very simple question. Okay, let's take up the next one. Which test is banned for diagnosis of sexual assault on a woman? Now, many of the students say no, this question did not come. Some of the references was no, there was a question like this. Anyhow, we have included this in the discussion. See, the whole idea of this band test is based upon examination of a female to assess whether she is sexually habituated or not. Okay. Sexual habituation of a female. Sexual habituation of a female means whether she is sexually experienced or not. And what used to be done was a per vaginal examination was done and finger were penetrated into the vagina through the hymen. If the female was sexually habituated, the hymen would have ruptured and two finger penetrations were easily possible. This used to be called as two fingers test, right? But in 2013, Government of India, along with because of the references of Supreme Court, they ruled out that this test is outraging the modesty of a female. A female who has already experienced some sort of sexual assault, and again, these kind of tests being done to assess whether she is sexually habituated or not is outraging her modesty, and so this test was banned for assessment of sexual habituation of female. Right? So correct answer here is two fingers test. If this question came, remember two fingers test, which used to have a conclusion previously that whether a female is sexually habituated or not is no more practiced. Right, next. Chronic alcoholic came with complaints of agitation, global confusion, disorientation, hallucination, fever, hypertension, and autonomic hyperactivity. Right? After cessation of alcohol since 48 hours. So, what is the diagnosis? So, if you read the question correctly, a lot of clinches in the questions are given there. First, it is chronic alcoholic. So, when the person is chronic alcoholic, uh, he has to have certain cerebral signs of chronic alcoholism, risk of psychosis, global confusion is given, disorientation, right? But apart from that, the person is agitated, right? Hypertension, autonomic hyperactivity, all these things has suddenly started to happen with him after cessation of alcohol since 48 hours. This sudden precipitating situation that happens due to sudden withdrawal of alcohol in a chronic alcoholic, typically after 2 to 3 days, is called as delirium tremens. Right? Delirium tremens is a condition which precipitates in chronic alcoholic due to sudden withdrawal of alcohol. Right? The person becomes agitated, his blood pressure goes up, he wants to have alcohol, right? And when he is agitated and blood pressure is going up, at that point of time, he becomes dangerous also. Caregivers may be provided injuries by this person also. So remember, delirium tremens में ऐसा नहीं है कि वो सिर्फ विक्टिम जो है डिलीरियम ट्रेमेंस का वही सफ़र कर रहा है, वो विक्टिम जो है केयर गिवर्स को भी इंजरी प्रोवाइड कर सकता है क्योंकि इस समय वो गुस्से में होता है, एजिटेटेड होता है. दिस इज अ रिकग्नाइज्ड कंडीशन ऑफ सडन अल्कोहल विड्रॉल इन क्रोनिक अल्कोहलिक्स कॉल्ड एज डिलीरियम ट्रेमेंस. Next question. A person who at the time of commission of an offence was of unsound mind is exempted if they don't know the nature of the act or its consequences. This is known as, again a very simple question, this is known as McNaughton's rule. Forensic psychiatry में is something that we read it. It was included in IPC 84, section 84 of India में McNaughton's rule. McNaughton's rule basically is a rule of England. This rule provides defense for a mentally insane person in the court of law. अगर उसने कोई क्राइम कमिट किया है तो ये रूल ये कहता है that if at the time of committing a crime the person of an unsound mind did not know or cannot reason out that what he is doing is illegal, right? Then he is not responsible for that act. That's called as McNaughton's rule, included in IPC 84 of India. Next question, identify the antemortem drowning sign. Again, something which has been asked in examinations multiple times. A grip of a hand holding on to certain grass or weed material, particularly in a dead body which has been bought from a uh, water source. It This sign is called as cadaveric spasm. Cadaveric spasm of drowning, right? Cadaveric spasm of drowning. टाइम एंड अगेन हम अपने लेक्चर्स में इस साइन की बहुत सारी बात करते हैं. Okay, pugilistic attitude which is given in the option B is seen in 100% burns, where because of the burns the proteins of the muscles they coagulate, and the flexor being the heavier muscles, the body goes into an attitude of flexion. That is called as pugilistic attitude. Pugilists किसको बोलते हैं? जो boxers होते हैं, उनका ये जो attitude होता है flexor attitude, guarding attitude of the boxing, उस attitude में burns में body चली जाती है, उसको हम बोलते हैं pugilistic attitude, right? आगे चलते हैं. A patient is admitted with tachycardia, arrhythmias. On examination, multiple scratch marks present over the body. Probable drug of abuse in this patient is. अगर हम इस क्वेश्चन को ध्यान से पढ़ें तो सबसे पहले लाइन में क्वेश्चन में हमें दिया हुआ है कि जो भी ड्रग ऑफ एब्यूज है उसका मैनिफेस्टेशन कहाँ होता है. सो वी आर टॉकिंग अबाउट कार्डियक मैनिफेस्टेशन, टैकीकार्डिया, एरिथमिया. ओके, एंड दूसरी चीज़ जो हमें दी हुई है वो क्या है, उसकी बॉडी पे बहुत सारे स्क्रैच मार्क्स दिख रहे हैं. ये स्क्रैच मार्क्स क्यों दिख रहे हैं उसको? क्योंकि वो अपनी बॉडी पे बार बार स्क्रैच करता है, सिंपल. और किस तरीके की कंडीशन में बॉडी में कोई स्क्रैच करेगा? व्हेन द पर्सन फील्स दैट देयर इज समथिंग इन द बॉडी दैट ही नीड्स टू स्क्रैच. दिस कंडीशन इज कॉल्ड एज cocaine bugs. Okay, they are also called as Magnan's symptom, cocaine bugs. So people who are cocaine abusers, they develop this feeling that there is something crawling inside their skin. That is why it is called as cocaine bugs, and they try to scratch over their skin time and again. And cocaine has cardiac manifestations, right? So the simple answer here is cocaine. Okay, next question. A vegetable vendor with no criminal background is found dead with advanced decomposition. What would you do to recognize the body? So सबसे पहले तो क्वेश्चन में देखो क्या लिखा हुआ है. First is this person has no criminal background, and the second is his dead body is found in advanced decomposition. When this person has no criminal background, तो इसका कोई मैचिंग रिकॉर्ड होना अथॉरिटीज़ के पास मुश्किल है. तो व्हेन अ पर्सन हैज़ अ क्रिमिनल बैकग्राउंड, जनरली उनके डेंटल रिकॉर्ड्स रखे जाते हैं, उनके फिंगरप्रिंट्स के रिकॉर्ड रखे जाते हैं, राइट? अब किसी आदमी का कोई क्रिमिनल बैकग्राउंड नहीं है तो इन रिकॉर्ड्स का डाटाबेस में रखा होना ज़रूरी नहीं है. And on top of it, there is an advanced decomposition of the body. So body को readily देख करके पहचान पाना आसान नहीं है. So will we be able to recognize this body by general recognition? No, general recognition से हम नहीं recognize कर पाएंगे because it's a body of an advanced decomposition. Dental records नहीं होंगे because no criminal backgrounds. Fingerprints लेने का कोई फ़ायदा नहीं है. एडवांस डिकम्पोजिशन की बॉडी है, फिंगरप्रिंट्स लेना भी डिफ़िकल्ट होगा और कोई मैचिंग रिकॉर्ड्स भी नहीं होंगे. So how would we go to recognize the body? The answer is DNA profiling. Right? The simple answer is DNA profiling. Okay, one more question. A case of accidental burns in female, 35 years of age. Burns involves right upper limb entire right lower limb, entire front and back of abdomen. What is the correct percentage of burns? Remember rule of 9. कुछ लोगों ने ये भी कहा है कि रूल ऑफ 9 लिखा ही हुआ था क्वेश्चन में, दैट अकॉर्डिंग टू रूल ऑफ 9 क्या परसेंटेज ऑफ बर्न्स होगा. ओके, तो राइट अपर लिम्ब की कितनी परसेंट होती है? 9%. राइट लोअर लिम्ब की कितनी होगी टोटल, क्योंकि एंटायर राइट लोअर लिम्ब है. तो फ्रंट लोअर लिम्ब का होता है 9%, बैक होता है 9%. So right lower limb complete is 18%. Right? Then entire front and back of the abdomen. So front of the abdomen is 9, back of the abdomen is 9. So entire front and back of the abdomen becomes 18%. So what is the total? 18 plus 18 plus 9, which is 36 plus 9, that is 45%. The simple answer is 45% of total body surface area is involved. Right? So this takes care of the questions that we got from the recall of forensic medicine. हो सकता है एक आधी क्वेश्चन और आया हो. You know, if we get a track of it, we can discuss it sometime later. Right? Remember, these questions are based on the recall value. The real stem of the question, the real flow of the questions may not have been there, but this is best of what recall that has been collected. Right? Best of luck to all of you for your examination result now. आप लोगों ने अपनी पढ़ाई कर ली है, अब आराम से बैठिए, रिजल्ट की तैयारी करिए और भगवान ने चाहा तो आप सबका रिजल्ट बहुत अच्छा ही